Great. We almost made it on time. Good afternoon, everybody. I'll call the meeting of this session of the House Health and Human Services Committee to order. And in deference to our Speaker Pro Tem, Representative Jan Jones, would you like to present House Bill 370? Yeah.
All right. I'd like to ask for your favorable consideration of House Bill 370. It pertains only to one hospital authority, and that is the Fulton DeKalb Hospital Authority. I had a somewhat similar bill regarding this in 2013, but it appears that we need to make some further changes. Let me just say that I care deeply about Grady Hospital as a Fulton County resident. It serves not just Fulton County, but really the whole surrounding area. It plays a critical role in healthcare, and 3 of my children have worked at Grady Hospital. In 2008, just for a little background, the Fulton DeKalb Hospital Authority's role dramatically changed and frankly became far reduced. And this was around the time of following the Great Recession. Fulton was in dire financial straits, and they changed its structure. The Grady Memorial Hospital Corporation was formed to actually run the hospital. The authority's role was reduced to simply receive lease payments from Grady Hospital. Most of that money, it's in law, most of those funds are supposed to flow back to Grady to pay for indigent care and fulfill pension obligations. Well, since that time of 2008, the expenditures of the Fulton DeKalb Hospital Authority have not gone down. In fact, they've continued to rise every year, and the whole, it was supposed to reduce and go down because their responsibilities were taken over by the corporation. What the bill does is it further clarifies that their expenditures should be low, and it does impose some term limits that have been asked of me by some of the corporation's board members, some of the authority board's members. It would not affect no one who is currently on the authority would have to immediately leave. And that is all the bill does. I'd be happy to take some questions.
Thank you. Questions from the committee members for the Speaker Pro Tem? Okay. Representative Barton.
So is this just Fulton County, or is this for all hospital authority boards?
It is absolutely only pertains to the Fulton DeKalb Hospital Authority as was created in law.
Okay, thank you.
Other questions from the committee? Okay, do we have anyone that wants to speak on this bill? No one signed up? Okay, what is the pleasure of the committee?
Do pass.
Oh, wait, I got a question.
Do pass. Second.
Motion for do pass. We have a second.
Representative Schofield.
Do we have any further questions from the committee? Okay. Seeing none. Everyone in favor of the passage of House Bill 370, that's LC 338521, say aye.
Aye.
Opposed, no. All right, the ayes have it. Thank you very much.
Thank you, Madam Chairman.
I appreciate you coming to visit with us, Madam Chair, Madam Speaker. Okay, moving on, let's go to Representative Burt Reeves with House Bill 271.
Are you ready?
We're ready.
Thank you, Madam Chair. Somehow in 7 years, I've managed to avoid your committee until right now. So I'm shaking, but.
Yeah, we're so scary in here. You've got good backup. You've brought the person from my district
That's
in
right.
my area to back you up. So I think you're safe.
Well, that's great. So the House Bill 271, I'm going to briefly explain and then back away and let my backup chime in. But this is a bill for the private ambulance industry. Obviously, the chair is referring to Mr. Pete Canones, who's here, is going to speak on this. He owns the private ambulance service in Cobb County and all around. It's called Metro Ambulance. He's also one of the leaders has consistently been one of the leaders in the state organization, Association of Private ambulances, and they are seeking a change in law that ultimately will allow them to be able to draw down more Medicaid funds so that there'll be more parity with the public hospitals. And so with that, I would like to turn this over to Mr. Mackey and Mr. Canones, if it's okay with the chair and the
Well,
committee.
wait just a minute. Let's see how well you know your, is it not my understanding that maybe they have one of the best time records in the state for the ambulance service?
They're an excellent company, and their response times are very, very good. And they set the standard, and they set it very high.
Okay, I guess you did your homework.
As we like to say, it's better in Marietta.
Yep.
So,
well, come on now. It's better than Marietta and East Cobb. So, right? Yes, ma'am. Correct? The answer is? Okay, going on to the next bill on the.
Whatever you speak of. So.
Okay, go ahead.
Can I get some help up here? Y'all want to talk?
Hi, I'm Josh Mackey. I'm here on behalf of Metro Atlanta Ambulance and Mr. Canones, its CEO. He also serves as the president of the Georgia Ambulance Providers Association, who's supportive of this. In addition, the General Statewide Association, the Georgia EMS Association, is also supportive of this bill. As Representative Reeves said, HB 271 simply allows private ambulance services to take advantage of a supplemental Medicaid payment program called UPL. Under this, providers can provide to the state the funds for them to be matched by the feds and supplement their reimbursements. Currently, DCH has programs that are just now being implemented for hospital-based ambulances and public-based ambulance services. Unfortunately, the feds require for private companies that they have an assessment put on them by the state, and they require a statute to do that. So the whole point of this bill is to bring parity to the industry so that all three groups, hospital-based, public, and private, will get the same reimbursement.
Questions for Mr. Mackey from the committee? No questions? Okay.
Great.
I don't know which one did you want.
Would you like to speak? Or?
Thank you very much, Madam Chair. Appreciate very much being able to be here today. We're, as an association, looking to, as Josh mentioned, just to create parity with the hospital-based services, with the fire-based services. For whatever reason, where we're left out on the original transcript that enabled this process to occur on the UPL, the upper payment limit on Medicaid. Just want to make it clear that this is not the taxpayers of Georgia picking up the tab. It's the providers. There's going to be about 15 ambulance services that will fall in this category, and they will be the ones paying the front 33, 34% to make this happen, which will be matched. So it's basically our vehicle to be able to be in parity with hospital-based and government-based ambulance services. And I appreciate the opportunity to come before you.
If you'll wait just a minute, we have a question from Representative Hatchett online. Matt, go ahead.
Hey, can you hear me?
We can.
I'm just wondering Josh, what is the percent increase that this will overall? I know probably each one might be different, but just kind of an overall increase in the percentage that you're talking about.
I can take that.
Go ahead.
So that has to be, it's yet to be determined. Representative Hatchett, they design each of these programs specifically. There will be parity between the three different parts, but part of it is how much Medicaid transport you're doing. We're going to determine that, but there is a cap. That's what upper payment limit is. It's basically the gap between Medicaid and Medicare, and you're able to go there. So you can only get federal matching reimbursements to a certain limit. But once we pass this law, we'll be allowed to work with DCH to design the program and figure that out.
Thank you.
Okay. Other questions from members of the committee? Oh, okay. Okay.
Am I on? Okay, yeah. So as I understand it, this is not going to increase the cost to the patient. This is more of what we do already with, say, hospitals, and where they pay into a fund and brings down the federal match, correct?
Yes, that's correct.
Okay, great.
Okay. Other questions from the committee? We have no further questions. Is there anyone in the audience that would like to speak? Anyone else? Okay, seeing no one. What is the committee's pleasure on this? We got to move to do pass on the substitute to House Bill 271. Do I hear a second? Okay, I have a do pass and a second. Any further discussion? Okay, none. Everybody in favor of the passage the substitute to House Bill 271, LC 338672S, say aye.
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 Opposed, no. Okay, the ayes have it. Thank you very much.
Thank you, Madam Chair. Is there rules forms in here? Or do I get one from the?
No, you have to get them from the
Okay.
Rules Committee. Be sure and fill
Thank
them out.
you, committee.
You're welcome. Come back and see us sometimes. Don't wait 7 years. I don't know whether that got picked up. Representative LaRicca, House Bill 346.
Thank you, Madam Chair, members of the committee. I bring to you today House Bill 346, LC number 338584. Try to do this really quickly because I've worked on this for about 4 years. Y'all may remember this bill is going to be called the Gerum's Act. I brought Gerum Waldron and his family. His dad's name is Chris, his mom's name Amber. I brought them to this committee a couple of years ago just to meet Gerum. He suffers from a rare disease called congenital adrenal hyperplasia, CAH. He has the salt wasting form of that, which is a deficiency of the 21 hydroxylase chromosome. And so that can create a deadly problem for these people that suffer with CAH. They can get an injury or have a virus or just anything, and the way that their body responds to trying to repair itself can literally send them into a shock that will kill them within just a matter of minutes or hours. And for us, or for me, when I began to learn about this, I was just blown away. I said, surely not. And they told me the story of Gerum when he was born. You know, we have these infant tests that they do right when the baby's born, and those tests have to be back within a certain amount of time. Well, undoubtedly, his tests were late coming back, and he was on day 9 and almost dead before they rushed him to Children's Hospital of Atlanta and saved his life, recognizing that he had the salt wasting form of CAH. So as he began to grow and they learned about how to treat that when he was in crisis, when you're in adrenal crisis, you have just a matter of minutes to take an intramuscular shot of what the name that I know it by is Solu-Cortef. And in here, we'll talk about how it's listed. He was in Nevada with his family. He went into crisis and was in an ambulance 25 miles away from the nearest hospital, and the EMS personnel could not give him a shot of the drugs that his mom had in his care bag. He has a bracelet that he wears that identifies him. It's a medical alert bracelet that identifies him as a CAH patient. And he has a care bag that actually has the instructions in it and the dosages and all to give him an intramuscular shot. And so that's a quick story about my introduction into all of this, some of the history. And I wanted to just run through the bill real quick with you and tell you what it does. I've learned that you never say it's a simple bill, and it's a complicated bill, but it's short. So if you just go over to to page 2, starting on line 16, it defines congenital adrenal hyperplasia. Line 18 defines emergency medical services personnel. Then down to line 21, you'll see where it actually starts, the meat of the bill. That emergency medical services personnel shall be authorized to administer hydrocortisone, sodium succinate intramuscularly for the purpose of providing emergency care if these 3 criteria, if these are the 3 things that are happening. Number 1 is that they actually have the congenital adrenal hyperplasia, and they're identified with these medical alert bracelets like people wear now for other diseases, and is in adrenal crisis. So if they are in a car accident and they suffer some sort of severe injury, the EMS look at that bracelet and they say, hey, this is a CAH patient. Within minutes, they start going into crisis because that body is trying to figure out how to repair itself, but it is almost working against itself and can go into crisis. And so number 3, that has on his or her person the hydrocortisone sodium succinate in the packaging that clearly states the appropriate dosage and has an unbroken seal. And so some states, the way they addressed this was by requiring ambulances to carry this drug on the ambulance. I'm not a big fan of requiring anybody to do much of anything. And so what this just allows is that the EMS personnel can administer that shot if those criteria are met. Because Gerum, that this act is named after, he has a care bag in every classroom in his school. His football, baseball coach has one, and anybody he spends the night with has a care bag and have been given instructions as to what to happen if he goes into crisis to give that shot. Now, after you get down past lines 29, the remainder of this bill, and this is where Betsy may have to help me, the remainder of this bill is the liability language in the event that an EMS personnel either administers the shot or does not administer the shot based on what is happening on the scene of where this patient is at. Because you could imagine if it were some sort of a tragic automobile accident, there are probably other trauma things that they're working on that they might not even see the bracelet with severe bleeding or head injury or whatever. These EMS personnel may be looking at stopping bleeding and not worried about giving a shot. So the remainder of this language is basically the liability language that's in other bills where emergency personnel have to respond to a trauma situation and protects them from civil liabilities, et cetera. And now we could go down it line by line if there was a line that you would ask a question about, but that's in general what the bill does. And we've worked with CARES, it's congenital adrenal research and education support. We've worked with NORD, which is the National Organization for Rare Diseases. So this policy is not a new idea. I tried to do it differently than they did by requiring ambulances to have another medicine and go at it this route. So, Madam Chair, thank you, and I'd be glad to take any questions.
And just for clarification, any of these children would be, when they're of the age to be independent and away from their parents with them all the time, would be carrying these drugs or have them stashed at different places anyway.
Yes, ma'am.
So they should be available.
Yeah, they carry them, but they have to. It's life or death.
Okay. Okay, Representative LaHood.
Yeah, thanks for bringing the bill. Could you tell us how many people in Georgia have this diagnosis? Do we know?
Yeah, as far as based on the birth rate right now, it's about 1 in 20,000. And both parents have to be carriers of this particular. If only one parent is, then you don't get the CAH. But if both parents are, you have it. So it's 1 in 20,000 right now.
Okay. Finished. Representative Hutchinson.
Thank you. I'm surprised that this wasn't happening already. What are the limitations of EMS workers anyway? I would have thought that this is something that they could have done without a law.
No, ma'am. Betsy may have to help respond to that, but my understanding is that there are medications that they carry on these ambulances for their emergency responses most all the time. And actually, if the previous presenters were here, they could probably answer that. But these rare diseases that have this particular kind of drug, it's a very inexpensive drug. It's only $10. And the shelf life on it is years because the liquid is separate from the powder and you have to shake it up to inject it. And so I think with it being as rare of a disease as it is, then there was just never a move. And this has only been about 25 to 30 years that we've really begun to understand this. It was only added to the infant blood test in my lifetime, 25 years ago or whatever. They were not even testing for it. Children were dying and they were thinking it was SIDS. And it was actually something related to CAH. And Dr. Newton or someone may be able to clarify that, but no, states have just never addressed it. Like in Nevada, Gerum, this young man was about to die and the mama was begging the EMS driver to administer the shot. Luckily for them, he gave the shot, but legally he told her, I didn't give this shot. And now Nevada has since changed that law.
I think that would be, I mean, what you have on the ambulances, you know, is under their control. This would be like taking something, even though that they haven't broken the seals of it. It's somebody else's medicine that you don't know for sure what's in it. And,
Right.
you know.
So if somebody has an EpiPen,
Yeah.
can they do an EpiPen, even though it's not on there?
I would imagine, I imagine they carry EpiPens with them.
There's a law that authorizes them to carry those on their ambulance and administer those. And there's a sort of counterpart law in the school setting as well. School nurses retain those on site and administer them.
Okay, I was just curious.
And it is my understanding, Betsy, that school nurses already have the right to administer this drug. And
well, if the child had the prescription with them, yes.
Right.
Yeah, like any other, like say giving insulin shots to children that are, you know, second grade or something. So
right.
Nurses do that type of thing already.
Okay. Representative Newton.
Chair, I appreciate the bill and the approach that you have to it on not, like you say, adding another medication for an incredibly rare thing that they have to keep up with. But at the same time, I think what the chair lady said with the fact they don't know how the medicine's been stored, there's some liability, or at least there would be, of injecting something that you don't really know what its history has been. I think this was an excellent way to do it. And obviously we got Narcan and EpiPens and things like that the EMS would have on board, because those are a lot more common. But for a rare disease, I think you've picked an excellent way for the families to prepare the child or the young adult for this. So I appreciate the bill.
Dr. Newton, one of the interesting things about this particular drug is you cannot overdose them on it. It is only replacing what the adrenal glands would normally be doing in the body all the time. As we sit here today, our adrenal glands on the tops of our kidneys are producing exactly what we need to heal our bodies of things that we don't even realize we're going through. So if you inject this $10 drug intramuscularly, if they injected it into a person that didn't have CAH, you'd never even feel it.
Right.
And a person that does, it literally saves their life in an hour. And so it's kind of remarkable, but we have to work that out in law because of how people need to be held accountable.
Representative Hawkins.
Yeah, Representative Luricki was going where I was going to say, I administered that drug one time in 43 years to an Addison patient about 11 o'clock at night with an oral surgeon on the way to help me stop a bleeder with a guy that ate the steering wheel. But to my recollection, and correct me if I'm wrong, the only side effects to this drug are headaches, dizziness, nausea. You know, I mean, the side effects are very minimal. So I think this is a good bill. You agree? Yeah.
Okay. Representative Sharper.
Thank you, Madam Chair. Thank you for this bill. If we look at line 29, where it says, all emergency medical services personnel shall obtain appropriate training regarding the administration of this drug. I don't know if Betsy or whatever we need to do, but if this is an intramuscular shot, a lot of times your basic EMTs, which will be on the emergency medical technicians, sometimes they're not allowed to give those type shots. So I'm just wondering, have you spoken with anybody about that for the basic EMT to do this? Your cardiac techs and your paramedics can do this. And then you say, or first responder, meaning possibly firefighters and things like that. So when you're saying all emergency medical service personnel shall, that's what it means. You're saying that all of them shall do it. So that's going to be a lot of training for us, even when you got the first responders, if they decide to do this, but you haven't mentioned that in line 29, but just the side of the EMTs being able to do this is going to be I think maybe the
the way to reword that would be EMS personnel are all trained in the ability to give intramuscular shots. Would you agree? And so they're not necessarily trained on how to give every different type of drug intramuscularly. So I would be willing to maybe look at changing that that particular, drug name, where it says the hydrocortisone sodium succinate, or the appropriate training regarding the administrative hydrocortisone sodium succinate, to intramuscular, injection, or intramuscular injection by the rules and regulations of the Department of Public Health. And that would cover that. What you're asking me about would cover that, because you were trained to give an intramuscular shot.
Well, as a paramedic, but
right.
When I was an EMT, we couldn't do that. But I was just wondering if there's an updates of information that about that they can actually do that. You get what I'm saying?
Mm-hmm.
So that would need to be confirmed.
And that's what this bill will give them permission to do.
Okay, but far as us being able to do that, far as the curriculum of a program and their protocols, that's what's going to be the important part. We can't just by law right here say you can do this, but it hadn't been through any kind of boards to be able to say you can actually do that. But if somebody's here can answer that, or Betsy or anybody can answer that, that'll be helpful, or Dr. Newton or
Betsy?
If there is some other law out there that says that EMTs can't give intramuscular, or it's not in their scope of practice, or how does, because this law actually could grant that authority to EMTs, even though they don't have that authority in other contexts.
Okay.
But it may be that we need to look at where that is and kind of either cross-reference it or sort of say, carve it out as an exception.
All right. But I'm just making sure we can, once you do that, even he's gone, the other guy, the ambulance service, but everybody's going to just have to be able to do it. And at that point, add that to their protocols through their medical director, saying that you can do this. You know what I mean?
Yeah, I guess
I'm for it.
Yeah, I was not aware that an EMS personnel could not give an intramuscular shot.
Yeah, some of them, because
you almost absolutely blows me away.
Right, because they can do the sub-Q shots, subcutaneous epinephrine, things like that. But as far as going deep on certain things, but there's just something to look into.
Oh, absolutely.
Just to make sure.
Absolutely.
When you say all personnel, okay, because you have a basic EMT that does a small amount of things that can't do those particular shots.
Representative Newton.
I guess when I look at this on line 21, Representative Sharper, where that's where we officially now authorize them to do it. And then down in 29, as you mentioned, that's where Department of Public Health would promulgate regulations, rules and regs to, now that we've authorized them to give an IM shot, and you're right, not Narcan or EpiPens that are sub-Q, but something that's IM, then that's probably the point at which they will make it a part of the Department of Public Health's rules and regulations for basic EMTs, along with all these others. But it looks like we covered them in line 21, giving them the authority.
Okay, and that's
if that helps.
And then, are you okay with, like, when you say first responder, firefighters would be first responders, police could be a first responder as well. So if they're authorized to do it, that's fine. But like you're saying, the Department of Public Health would be able to get the EMTs, if that's what they want to do, to be able to give that shot.
No.
But when you just add first responder, we just wonder if we need to be specific.
Where are you saying first responder?
In line 19, or first responder. But it'll be fine.
Representative Riccio,
well, my question is, it's answered. Let's just put it like this. The line is good on number 18, where you go through all that first responder associated with emergency medical services. We're not worried about the firefighters and policemen on this. And then Department of Public Health will make sure the training is okay. So this is good. I mean, as long as they're gonna do.
Would you like for me to say something about that, Representative Sharper?
Oh, go ahead.
Okay. If we're talking about firefighters and police.
But we're not.
Wait,
Okay, go ahead. Go ahead.
are you my co-chairman on this committee now?
I guess, I don't know.
Yeah,
I'm
I'm
just kidding.
teasing you. It's okay. I'm asking, I mean, do police normally give IM injections or firefighters?
Well, two things. The police are bringing more and more people that they've given Narcan to. Now, once again, that's not IM,
That's
but
not
we
IM.
specifically allowed that, and then they went back and did the training for it. I will say firefighters are often, especially you mentioned a car wreck is a classic example. It can be even a sporting injury. It can be a while before a paramedic gets there at your level who's able to either start an IV or give it a different way. I think the goal of this bill is to recognize the importance of time. I know I had a constituent contact me the other night that with a COVID problem, and they took 50 minutes for the ambulance to arrive. Well, if you can imagine if that was a patient, probably wouldn't have done that from a car wreck, but that was just a particular story I heard. You may need the EMTs or the basic EMT firefighter who shows up long before many of the ambulances do because of their location. I think it's a helpful thing to allow them to do it, to allow them to get the training. Training may be different than certainly you'd give a paramedic because you give more of the science background with the paramedic.
Are the firefighters paramedics?
No,
Well,
not always.
Not all of them, but some of them are. They could be, and I'm going back to what you're saying. When that person came on the scene and that child or whatever couldn't get himself, but they had it on hand even at the house. If they have to wait a long time, the firefighters get to the house. Sometimes they do respond before the paramedics get there. And if the mom say, "Hey, look, can you give this?" The firefighter is going to have to say, "I can't," but it could help. Like Dr. Newton saying that if it was involved, but.
Okay.
Right.
Representative Lurie, we're going to meet again tomorrow. Can you get with me and Betsy and let's try to work this out?
Absolutely. Absolutely.
Okay.
I'll try to reach out to Dr. Newton too. And we will, whatever the will of this committee is, I told you, I'm not pushing. I've been working on this for 4 years and want to get it right. And I appreciate Representative Sharper.
Okay. I mean, unless Betsy, you had a way to solve it now, is it better for us to wait until tomorrow?
What do you mean solve it?
Well, I mean, narrow it down to.
I personally think we are covered because of the definition of emergency services personnel, the way that Dr. Newton described it, because then it later goes on to talk about. Yes, ma'am.
You're not Betsy. Okay. And we are looking.
Nor the co-chairman.
We now have two. Okay. I can use all the help I can get. Let's just suspend this. We'll come back tomorrow. I want to talk to Betsy about it. And we'll get it straight. And Representative Newton, the official co-chair, or not co-chair, but vice chair, we will discuss it and pin this down for you. Now, wait a minute, let's finish up. Does anybody on the committee have any other questions about the bill? Regarding the bill that came to mind? Let's discuss them now if you do. Is there anybody that wants to speak on the bill? That signed up to speak on the bill? Okay, we're not going another year. We will get this settled tomorrow.
No problem.
You show up for the committee meeting. I think we're at 12:30 till 2 or upon adjournment, but we'll get you in sometime in there.
Absolutely.
If we have to meet in the hall.
Thank you,
That
Madam
runs
Chair.
out of this room.
Sounds
Okay.
perfect. Thank you.
Thank you. Okay. Thank you, Representative Sharper. We'll get it worked out. Okay. You want to go Representative Howard after that, or you want me to try one first? You ready to go? Yeah, let me go. Okay. Okay. Okay, and we're going to take Representative Howard's House Bill 437.
Would be good if I'm looking at my audience. Okay. Thank you, Madam Chair. This is a bill that we took up last year, and because of COVID, it got caught up in the Senate and never. So we had to bring it back this year to redo it. So this is LC. I better get my glasses.
33863S.
That's correct.
Okay.
And substitute to House Bill 437. And most of you may remember this. I'm not sure how many new members we have, but it's an access to the pump bill that would request that service stations across the state would put signage on their pumps that if a disabled person pulls up to the pump and needs some assistance, they can call into the station and request someone to come out and assist them to pump gas. And if that station has more than one attendant inside the station that can come out and without leaving the building unattended, then they will come out and assist that person with pumping the gas. There was one amendment that we missed putting in here that we actually took up last year, and we missed it some kind of way. Did Betsy leave?
Yep. She just stepped out for a minute.
Okay.
Is this the one, did it say nothing contained in this code shall be deemed to create a private cause of action?
That's correct. Yes, ma'am.
That's what it said in total?
Yes.
Okay. I'll make the motion to do that when we get down to this.
But that's it in a nutshell. And I would appreciate your favorable consent on this.
Okay. Oh, Representative Hutchinson.
I just wanted to thank Representative Howard for taking this up again. I remember the conversations that we had on it last year, and I believe we voted for it unanimously out of committee, and at the appropriate time, I'd like to move to pass.
Okay. All right. Other questions from the committee? Okay. Representative Newton.
Just curious, on line 17, are petroleum stations already required to have an operational telephone, like a landline, or is that a new requirement for them?
Yeah, federal law already is in place for this, but over time, there's not been, the technology has not caught up with what it takes for a person with a disability to gain access, because you honk your horn or is what federal law says. And so what we're asking is, you're not going to honk your horn and get attention at the service station these days. So what we're asking is put a phone number on the signage on the pump, and the phone number would give you access to calling into the station, and that whoever the attendant is can come out and assist you.
That's a quick follow-up.
Yes.
This code on line 13, the code section 40-2-74.1, is that a special disability permit, or is that, we see a lot of people parking in disabled areas that may not be mobility disabled, or obviously sometimes it's not obvious what the disability could be.
Excuse me for cutting you, Doc. I'm not sure what that code section is. If Betsy pulled that up for us.
I didn't know if there was a special section if you're actually in a wheelchair versus can't walk steps.
Well, it does. You have to have your disability hanging
tag,
or you have to have a tag, and you can't have another physical person in the car that's over 16 years old that's not impaired. If you have another physical body in the car that can pump for you, then you can't request that assistance.
Thank you.
Okay.
People need to mute your computers and your, when you're not speaking. Thank you. Okay. Angela, can you come for, I know you want to speak on it. Do most convenience stores have I think what Representative Newton was asking, do they have a landline?
Yes, ma'am. Most of them do. Most of them are required to.
That answers, wasn't that what you were asking? Okay. So they have a landline. Okay. And I know you want to say more than just answer my question, so go ahead.
Thank you. Thank you, Madam Chair, and thank you, committee members. We appreciate working with sponsor and working with legislation that'll work for our convenience stores. Currently, ADA regulation does require that if there's more than one attendant for someone to come out and pump gas. But in order to get that person to respond to you, it only requires that they honk the horn in the parking lot. And as we know, he's correct, that's not working for most Georgians. I believe, if I'm not mistaken, the numbers last year told us that only about 16% of Georgians with disabilities are actually mobile yet immobile as far as being able to pump their own gas. And I don't know what that number equates to in numbers, but I know it's only about 16% of the disabled population. And then there was one other thing, and I know I had mentioned it to Representative Howard a few days ago. There is a mobile app that has become available recently. It's not yet in Atlanta. We don't yet have any retailers on it in Atlanta. I've reached out to some of my board members who are interested in participating in it, but it is for disabled individuals to actually find a pump. So, and I know that it's not available yet in Georgia because the closest location to me was in Orlando. So right now it's being sponsored by or widely supported by Shell stations in other parts of the country. So we're looking forward to bringing that to the metro area. And I believe that was, we're comfortable with the bill, with the amendment.
Thank you. Representative Howard, do you drive from Augusta up here by yourself?
At times, yes.
Okay. Sometimes it makes me very sad that something has to happen to one of our members or a family member before we realize that we need to change a law.
Yeah, and
instead of hawking. And you are a good example that you have overcome your handicap tremendously by getting out. Would be next to impossible to fill up gas between here and Augusta if you needed it.
Yeah, and you don't really know what a person that has disabilities go through until you become disabled. You don't pay attention. We as the ordinary citizens don't pay attention, and that's what I can attest to. Things that I never thought about, never came across my mind until I was disabled, and I began to wonder how did people like me make it through these situations. It's really unfortunate that you have to go through this to understand what it means. So
it is, and those of us that do not have physical ailments and have all our limbs and can easily move around are truly, truly blessed. And thank you for bringing this. Were there any other questions by the committee? Okay, let me get what we're going to do with the committee before I offer the amendment.
I have my hand raised, Representative Jones.
Sorry, Representative Jones. Hi.
I have a question.
Okay.
My question is, the answer, I believe, came back that most service stations are required. Most service stations have landlines. So I wonder, what about the ones that don't have landlines? Should it be posted?
I guess they're going to have to wait for that mobile apt to come, or either the individual would have to choose another station at this time.
Okay. All right.
I really don't think it would be workable for us to try to require the people to have landlines, because it really wouldn't be enforceable.
Okay.
So
they don't need to post their mobile number up there or any number. Just we want to deal with this for right now.
Oh, they just have to post a number where you can reach somebody in there. So if it was a mobile number that was person was gonna be there all the time, it would be acceptable.
Okay, I thought it was just the landlines that we were talking about. That sounds good then.
Okay, thank you for your question. Any other questions? Have we missed any other hands? No? Okay, no questions. Okay, what's the, Representative Hutchins, you wanted to make a motion? Okay, we've got a do pass.
Second, Sheila Jones.
Okay, thank you. Okay, we have an amendment. So let me make the amendment. The amendment would be, Betsy, can you read it? Where it would go?
All right, it would go on page 2 after line 30. It would be a new subsection C that reads, nothing in this code section shall be construed to create a private cause of action. And we also need to add something in the title to reflect that addition. Okay. So on page 1, line 4, after the semicolon after assistance, add to provide that no private cause of action is created.
Okay. Are there questions? Okay, can I have a move? Okay, do pass. Oh, you have a question? Do pass on the amendment. Do I hear a second? Okay, can I get a vote on the amendment? Everyone in favor of the amendment as just read by Betsy, say aye.
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 Okay, anyone opposed? No. Okay, the ayes have it. Then let's go. We have a do pass on the bill and a second. So we would be moving on the substitute as amended to House Bill 437. Everyone in favor say aye. Anyone opposed? Aye. No. Okay, the ayes have it. Representative Howard, your bill has moved on out. Be sure you go have somebody get you the rules form that you have to fill out because they won't put it up. The Rules Committee won't consider it unless you fill out that form. Okay, all right. Would you like to take over, Representative Newton? Can you do it from there? Okay.
Sorry. Thank you. We'll go on now. Which, do you have a particular order? You want to do 458?
Let's do first, just going down to, let's do 458.
All right, let's go to, we'll be doing House Bill 458, LC 338685S. Chairman Cooper.
Okay. There's been a lot of, over the past year or two, a lot of discussion against physicians and a lot of examples from across the country, not so much in Georgia, but occasionally, of physicians who overstep the boundaries of what's appropriate on sexual behavior. And so the Board of Medicine has asked and has developed this bill with input from me to tighten up some of the things that they do to be more transparent with the public. And the first thing is in section 1, there's something about the dental board or the dentist. And that came out of the fact that Senator Kay Kirkpatrick was moving a bill in the Senate, and one of the senators tried to amend it to have this language in it, which also, brings the dentist having to do more in the way of, helping their dentist understand the sexual boundaries. So that's section 1. Section 2 says that the board members that are going to oversee all of the doctors in the state, that they will get greater education so that they will have better understanding of sexual misconduct, sexual boundaries, and the impacts and trauma and implicit bias of these events. So even the board would have to get educated. Section 3 is what the board has been doing, but it has not been in their law, apparently, specifically spelled out. If they have a person that is accused of sexual misconduct, if that person comes to the board of the medicine and admits what they have done, or if they are found guilty by a court of law, or if the board, under their investigation, even if like there is a police or a legal investigation and it's not completed, if the board finds that they are a danger basically to patients, they can suspend their license. And this puts into law what they have been doing. Section 4 would require that all physicians have a minimum of 3 hours of training one time, just like we did for their ordering of opioids. And it puts out, and that's a minimum, so the board can require more if they so choose on the same kind of education that the board would require on sexual misconduct and all. In Section 5, the board is to develop educational resources and materials for physicians on this issue and to make it available to them. In Section 6, starting in June of 2022, our medical schools shall also include training on sexual misconduct for our medical students in the state in their curriculum. Now, Section 7 is about reporting and also making sure that if you are another physician and you know of another physician that is overstepping the bounds, have crossed over and are conducting illegal and inappropriate actions, that you are bound to report them. And there are consequences that, you know, in our law and our other laws, we have them all over, that if you don't report child abuse and all, that it is a misdemeanor. Well, I can tell you that what doctors are afraid of more than a misdemeanor is being reported to their board of medicine, because their license hangs in the balance of it. So what we did is that if, you know, they're found not to have reported, that they can be fined anywhere between $1,000 and $5,000. And that if the board thinks it's even worse, let's say we had a condition or a situation like they had up north with the personal trainer who abused those children over and over again. If there was another doctor that worked with him and knew it was going on, where he was abusing those young athletes, I would call that really egregious. And if I sat on the board of medicine, I would want, if it wasn't reported, a stronger fine, and the board would have that right to do it. And it lays out this article. And in Section 8, which is the end of it, they will begin to report, not with identifying information, but so that we will have a report on, you know, how many people that have come before them to be investigated, how many people were found guilty, how many private, how many public orders they gave. And, you know, I can think of an example where it might be a private order. I understand that there was an emergency room physician, Dr. Newton. There was an emergency room physician that treated a patient and then later dated that patient, and they ended up getting married. And somehow or other, you're not supposed to do that without sending a letter to the patient saying, I can't treat you anymore, apparently. And that doctor would have gotten, I think, a private order that said that they went away for 3 weeks or something and took an actual course on this. So he was issued a private order on that. So this will be reported back to the legislature so that we have a better handle on just what's happening in our state. And that it's an important bill. And I appreciate the fact that the Board of Medicine brought it forth and wanted us to update and add these additions for them. And I'll be glad to answer any questions.
Thank you. Are there some questions for the author online or in person?
Representative Hawkins.
Just a question on section 1. Is the dental association there? Have they signed off on all this? Oh, there he is.
We have somebody
I
who would
mean,
like to
and the only
speak.
reason I'm asking, it's not a bad idea. It's just a long list of things to be put in the CE other than just the sexual. And, you know, I know we touch on these things from time to time. We have courses, but I'll stop there. I've just asked some questions.
Thank you. Any other question? Oh, would you like to?
Would you like me to answer that, or
No.
is it appropriate time?
Yes, go ahead. Go ahead.
Chairman Newton, Chairman Cooper, members of the committee, my name is Scott LaFranco. I'm the General Counsel and Vice President of Government Affairs for the Dental Association. I've sent Chairman Kirkpatrick the language. I actually haven't seen it incorporated in your bill. Would it be okay for me to look at it real quick?
Sure, sure. Somebody, can you, Representative Hutchins, can you hand in your bill? It's section 1.
Yes, ma'am. This is a different one.
If you'll give it back to her, their bill back to her when you're finished.
Okay, yes, ma'am. So this is this tracks the language that I sent to Chairman Kirkpatrick to address the issue on the bill that occurred on the Senate side. We actually passed a rule through the Board of Dentistry this last year with this exact language. We did add existing language in the rule. So there is a current Board of Dentistry rule that says, it's considered unprofessional conduct under the Dental Practice Act to engage in unprofessional conduct relating to the commission of acts of sexual intimacy, abuse, misconduct, and exploitation with regard to the practice of dentistry. So all I did was add that in, and it's an existing rule. It's been on the books. This language right here was actually passed through the Board of Dentistry through the rulemaking process last year, and we've just been waiting on the governor to sign off on it. So that's where this language came from, Dr. Hawkins.
Okay.
Well, thank you. Chairman Barr.
Sorry, I'm over here to your far right. Thank you so much. Quick question on line 143, Madam Chair, requiring the physician's assistant. Would you clarify for me, do they take the 3 hours of initial training and then are they subject as well to the ongoing? And would that be a new, the second question then, would that be a new requirement? Do they have to get continuing education classes now just for the physician's assistants?
Betsy, this is just about reporting, right?
That's right. This is just reporting, and no, they won't get the 3 hours under this bill. It just will require them to report if they do have knowledge of some activity.
I mean, I think that we would do well to go back and put this in nursing and put it in the physicians, everywhere from RNs up to APRNs and the physician assistant. But right now, I was just handling what the medical board.
Very good. And one follow-up, Mr. Chairman, is that
Sure.
okay?
Go ahead.
And forgive me, but maybe the dad is coming out on me right now. But if someone willfully fails to report abuse, I feel like $1,000 is a very light fine.
No.
Is there some, I mean, for the dad in me, I'm thinking, let's, make sure this doesn't happen again. But is there any history on the $1,000 to $5,000 fine for not doing this?
No, this is new, but it's up, it doesn't have to be 1,000, it can be 5,000. And in addition to that, there can be a public reprimand on their record, or to the point they do have the right to remove a license or suspend a license or require that the person that doesn't report, it gives the board a great deal of leeway.
Okay, very good. That's what I need to hear. Thank you.
Thank you. Anyone, any other questions? Anyone?
Hutchinson.
Sure.
I was just going to address that question. Are we talking about professional fines or criminal fines?
No, we're talking about professional.
Professional, okay, because I do remember some really egregious cases where they went to prison or jail. So, which is a lot compared to $1,000.
No, I mean, that's just the minimum.
Yeah.
That's a good point.
I guess if somebody didn't report that the
Online.
emergency room doctor dated the patient that he later married, I would think maybe $1,000 would be, maybe, without sending a letter saying you wasn't going to treat him anymore. It seems like $1,000 would perhaps cover that, but then on up.
All right. Any other comments or questions? If so, we'll entertain a motion. We have a motion to do pass and a second. Is there any other further discussion among the committee, online or elsewhere?
Second.
If not, all in favor, say aye.
Aye.
All opposed, no. And House Bill 458 LC 338685S passes. Thank you, ma'am.
Okay.
Now,
Last one.
we'll go on to the last bill of the day, which is HB 539. Chairman Cooper.
Okay. Like I said, I appreciated the board moving the one on the sexual misconduct, but I've been working with the board for a year on what they call an institutional license. The Board of Medicine has a license that has been on the books for 20-something years, where if a doctor comes from a foreign country in a foreign medical school, under circumstances, and the board decided they could have an institutional license. But when that bill was put into effect, they considered and decided that an institution was only a hospital. And now, just like we moved a bill last year where there was a fund that helped mothers that were from low income families, but said they could only be treated in the hospital, we changed that to where they could be treated in clinics also, because it's much cheaper to treat somebody and the money would go much further if they could also be seen prenatally and all. Well, we are now where we have big clinics that treat many of our Medicaid patients, our Medicaid children, and the board has finally expanded that definition of institutions to be, clinics in this state are the services that predominantly treat Medicaid, indigent, or underserved populations in our state. It's not something that the board uses often. They're very careful to make sure that they do their best to make sure that we get good doctors in this state. But for example, I was over at Emory and ran into a young female doctor who was doing a 2-year fellowship in hematology at Emory. And I said to her, I got to talking to her and where she was from the Middle East. And I said, I do hope you're going to stay in Georgia when you finish your fellowship. Oh no, Representative Cooper, I can't get a license here. And so, I was told by one of the board members that's worked with us a long time, there's not a lot that have come up and applied for a license that we've missed, but there have been several really fine doctors that we have refused to give license in this state because of this institutional law, the way it was written and the way it was done. The board is to vote on the rule change on the 4th of March. It's right before we go to crossover. So just to make sure that the board passes that bill and makes that rule, or passes and makes the rule change, I decided to put this bill in. If the board makes the rule change, it'll just be sitting in rules if y'all agree to pass it. But I just got a little worried. We're coming down to the wire, and after crossover, it would be too late to move it. So that's why the bill mirrors the board's rule change, except They forgot to say that these doctors, if they don't work in a hospital or an institution, that they can have a DEA number. And I put that in this one, but I'm willing, if the board puts the rule in, we can go back and worry about that change later on if they need it. So that is why I'm asking for House Bill 539. And like I say, it mirrors what the board will be putting into rule except for the DEA.
Thank you, Madam Chair. I think it does bring out the strong move to outpatient care away from just a hospital, and the fact that a lot of the care can be done as an outpatient that maybe when this institutional definition started would have all been done in a hospital.
Right.
Are there questions for the author? Don't see any, none online. If so, do I have a motion? Have a motion to pass in a second?
Second.
Second, okay, thank you. Is there any other discussion? If not, all in favor of House Bill 539 LC 338561, say aye.
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 Any opposed, no? Bill passes. Thank you, ma'am.
May I say one more thing? If
Back
it's
to
okay?
you, ma'am.
I'm back
You're
to
in
me.
charge.
Okay, as chairman. Okay, Representative Hawkins. We have a problem with the dental board. We have on the dental board, a dentist that is foreign born, or foreign trained, and has license in 4 other states in the United States and is now a United States citizen, cannot get a license in Georgia. Working in 4 different states as a locum tenens, is that what you call it? Locum tenens, with no complaints against how he performs his duties, can't get a license here in Georgia. And we need dentists here in Georgia, especially in rural areas across our state. One of the board members just told me, a new board member, that he, is an oral surgeon. And sometimes oral surgeons are often MDs and DDSs, the dental things. His younger partner or associate is an MD and also a dentist, and could not get a dental license here without either going back to school or taking the exam again, and was able to get her MD license. The dental board and the young dental surgeon said that the board is going to be looking at it. We are losing good dentists also that can't get licensed in our state. Just like the board, I don't expect it to be wide open and we take just anybody. But if we are losing 1, 10 good dentists, we need them in this state. And so I understand they are going to be looking at some of the rules. I had to bring back Senate 5. We'll be coming to you next week because we found a problem from the dental board that we have to correct on that Senate bill on the use of sedation. It's not that the dental board is bad in the past. It's just that we haven't moved forward in recognizing that we are becoming more international and that there are good dental schools and good medical schools in some of the other countries. There are some that don't meet our standards and we have to be careful, but that we should make a pathway for people to get their license in this state if they perform. So hopefully we will move forward and you will be seeing some changes that come that way, and we may have to change some rules. So we're run late. Thank you very much for the attention, especially for the last 2 bills, and for being the best committee that we have. We will meet tomorrow on an important bill and Laricchio's bill at 12:30 to 2, room 406, not 606, 406. And if we get out of session earlier, let's just come on as soon as we get out of session, or if it goes past 12:30, as soon as we get out of session, we will meet immediately here and move those, work on those bills. And I appreciate everything. And like I say, I consider I have the best committee in the legislature. So thank you for all you do and the service to the people of our state. Thank you.
I'll second that.